So my philosophy is that the consultation process between me as the facial plastic surgeon and my patient is one of communication. And so that process has a number of steps. We'll have patient paperwork that the patient fills out, routine sort of information. They're then escorted back to our private consultation room, at which time my nurse takes pictures of the patient and then we'll take a detailed medical history. After the medical history is taken by my nurse, then I review that medical history with the patient and we discuss the patient's goals and expectations. Then the patient and I will discuss options to achieve those goals. Discussing those options includes both showing the patient some things that can be achieved with the use of a mirror, and also then at that point we have a computer imaging session. Computer imaging is not an exact before and after. It is designed to be a great patient-doctor communication tool. So once again, communication between the patient and myself. One of the major emphases also in the consultation process is that the patient needs to really be interviewing me and seeing, is this someone who I can trust with my face? Believe me, the consultation process is a time where it is not lost upon me the gravity of the decision that the patient is going to make. I mean, and I take that trust that they place in me very seriously. That trust is something that helps drive me. It's what I enjoy about what I do. And I also want to make sure that the patient has appropriate goals and expectations so I can meet those goals and expectations and have a happy patient. So the consultation process encompasses, a good amount of time, and a lot of that is in a way of saying, the patient and I are trying to get to know one another because it is a very, very important step for the patient to make. Most patients do a great job of coming in very educated. They've done their homework, but to sift through those things and get some of the realities of, well, that sounds too good to be true, and then I tell them, well, yes, it is. Here's how we achieve your goal. That takes some time to discuss. Yes, one of the most important goals that I have in my practice is that people have a very natural look, and that can be achieved. And I will tell them what it will take to achieve that. Many times it's not quite as quick and simple a fix as they would like, but I'm not going to shortchange their consultation by telling them what they want to hear. I am adamant about patient confidentiality. No patient that is a patient of mine will have that fact shared with anyone unless the patient chooses to share that fact. That being said, we do have patients who enjoy sharing their experience and basically say, look, if you have somebody who wants to give me a call, I've been down the road before and I've had a rhinoplasty and I'd love to explain how my experience was. We do have many patients who like to share their experience, and then we can anonymously put our prospective patient in contact with the former patient and they can ask questions directly of that patient. The main highlights that I like to review with patients are anesthesia, recovery process, if it's a surgical procedure, the incision placement and how these can heal and be imperceptible and invisible, and then also the timeline for their follow-up care and when they get back to work, if it's a surgical procedure, the outline sort of for their recovery process. But I encourage people to carve some time out of their schedule, do the right thing at the right time, not to take shortcuts, and then they will have a natural look, a long-lasting look, and they'll be pleased with achieving their goals.